As far as the pandemic is concerned, we're all glad that this year's winter season is over, after experiencing astoundingly high numbers of new COVID-19 infections then. As the numbers rose, so did the pressure on the health system's resources to cater for all those needing medical attention, most notably oxygen support machines and tanks needed for oxygen therapy. This then led to a flurry of companies advertising the sale of oxygen machines on social media for home use. Even though new cases have dramatically decreased, it still does not negate the fact people at home may not be well educated in the administration of oxygen therapy. As we recognize that the future is unknown, we realize that there may be a need to educate ourselves about the fine points of oxygen use, especially at home, because if administered incorrectly, it can be quite dangerous. So, first things first, before using these oxygen support machines and tanks, what do we need to understand? Who should take oxygen? Of course, Dr. Kiran Bhagat is here to share his expertise.
Coronavirus, using oxygen at home, some do's and don'ts to follow. Amidst the widespread crunch of hospital beds and resources across the country, there is also a rising demand for oxygen support machines, cylinders and other therapies, with many COVID-positive patients being advised to manage the condition at home to the extent it would be possible. With oxygen deprivation and lung infections becoming common problems faced by patients during the second wave, oxygen concentrators, cylinders come of good use at a time when it is becoming increasingly difficult to secure medical help in time. Some can also be well treated at home. However, that being said, with oxygen therapy, one needs to be doubly careful and be aware of the risks and dangers as well.
When is it unsafe to use oxygen?
Oxygenation should be preferred when oxygen levels readings drop below 93%. Ideal oxygen should be between 94 and 99%. While no oxygen therapy can instantly boost oxygen levels or restore them to normal, COVID-positive patients should aim to achieve a saturation between 88 and 92%. Many experts also advise that achieving 100% shouldn't be done when the body is sick, and more so will exhaust your resources as oxygen cylinders are expensive. While many people are beginning to hoard up resources indiscriminately, as exemplified by many adverts now appearing on the purchase of oxygen for home, doctors are also advising patients to seek doctors or consult specialists before they get hooked up to these machines. Some may require less use, while some may be advised to use it all day long.
I guess this is now time for me to ask, how should it then be used? When a patient requires for oxygen therapy.
Just like you would use a face mask, it's crucial to ensure that the oxygen mask also fits properly. There are no leakages or gaps in and around the nose, mouth or cheeks. It's advisable to use a proper sized mask so that the supply isn't disturbed. Sometimes a nose clip and tightened straps would further ensure that the mask is giving you a good fit. This is crucial to follow, since some masks would not be doing the same job. Resources are running scarce now, and a lot of cannulas, concentrator machines are being borrowed for use. Caregivers, patients should ensure that equipment and masks are well sanitized before use. While using oxygen concentrators, ensure that there's plenty of ventilation and open windows in the same room, which will allow nitrogen to escape free.
What are the precautions that we must consider when administering oxygen at home to a patient or really on ourselves?
If you have a pulse oximeter, which measures the oxygen from the tip of your finger, doctors now recently advised patients to keep in mind certain precautions before making use of external oxygen. For those individuals who are having an oxygen saturation of 92 or 94%, there is really no need to take high oxygen just to maintain your saturation. It's not going to be of any benefit. If your saturation is above 95%, you do not need to take extra oxygen. If it is less than 94, you need close monitoring, but you may still not need oxygen because oxygen is still sufficient in the blood if the patient is otherwise healthy. Patients, however, with chronic pre-existing respiratory lung conditions may require saturation to be maintained at higher levels, but aiming for a percentage above 97% won't do much benefit. The treating doctor will be able to advise you how to manage this. If you are having difficulty finding concentrators or cylinders, consult your doctor. Even with oxygen therapy and support at home, it is important to be on the lookout for signs of danger and be prepared to take the next steps. Since with an illness like COVID, things can turn bad, timely diagnosis and seeking help could save lives. Here are some critical signs of danger a patient may observe requiring contact of the ambulance or the hospital. The lips, face or tongue turning dark or getting discolored. Patients being unconscious and not waking up. Experiencing discomfort even when using oxygen. Degradation of other vital signs and symptoms.
What home remedies can be used to improve breathing naturally? Sometimes it's not all of us who are going to be able to afford, oxygen tanks or, oxygen therapy. Or maybe people don't believe in using oxygen.
There are lots of exercises and methods to try and boost oxygen levels naturally. COVID-positive patients are advised to sleep in the prone position. That means lying on their chest and have pillows placed under their neck, shins, and chest. Patients can also lie on their sides. Apart from having this, having a nutritious, iron-rich diet that improves lung function is said to be of benefit. Doctors say that when you suffer from a respiratory infection like this, the more you lie on your tummy, the better it is for you. There are patients who have said to have recovered or observed improvements in their health by simply lying in the prone position.